So like everyone else here today, there's a big team of people, first of all, that I'd like to thank that are behind the work that we do. So probably a few years ago, we thought of ourselves as an app development company. Probably today, we consider ourselves a health technology company. And we're on a journey to what we see ourselves becoming as a digital therapeutic company. So I'll get to what we mean by that. We've got a range of skills across app development, business analysis, and also very importantly, clinical advisors and patient advisors. The team also works across a business area called medical e-guides, and there's actually a poster outside on this, which I think it's Marie Tierney. It's around an antimicrobial prescribing app in Galway University Hospital. So my background to joining this team probably started in 2012. So it was when my father was undergoing cancer care. So at the time, he had amazing clinical care, but what was really lacking was the patient interface when you got home. And a lot of what's been touched on today is around tailoring. So when you think about medication adherence, it's very, very different from condition to condition. So there's a lot of generic solutions out there that are one size fits all, and they go some way to helping people in that area. But if you think about cancer care, the typical chemotherapy profile, every 2 weeks you're back in for treatment. Every one of those days you're taking different support drugs to do with anti-sickness, to do with steroids, to do with your immune system. And then 2 weeks later, your regime could change and you're back to square one. You're having to figure out what you were on 2 weeks ago, what I'm meant to be on today. So that concept of tailoring is something that's really important. So I mentioned digital therapeutics. So this is a quote from Dr. Joseph Kevdar in Partners Healthcare. And Avril touched on this earlier as well. It's the idea that a digital intervention can have a significant therapeutic effect in its own right. But of course, what's needed for that is the evidence base. So we're definitely not there with the evidence base with the work that we're doing, but we very much recognize that we need to gather the evidence base in the work that we're doing. And one thing I'm really keen that comes up in the later discussion is around, well, what's the right way to gather that evidence? So a few people have touched on that RCTs are maybe not the right way. So these types of tools maybe need a different type of study. The other thing which I think is appropriate is whether CE marking is required. So in some of the work that we're doing, CE marking is required. It would classify as a self-certified medical device, so we're on the path to becoming CE certified as well. And importantly for us, so we're a company that we need to make money from this in order to pay the wages to get the solution built. By becoming a digital therapeutic, it means it's much easier to get reimbursed, and reimbursement in healthcare is difficult without that evidence base. So we're looking at the problem today across patients and the health providers. So for patients, the challenge areas is around the burden to self-manage, the lack of information or validated information that they have access to, access to an understanding of their clinic results, because that has an impact on their beliefs and their understanding of their condition, and then that has an impact on non-adherence. For the healthcare provider, it's well documented. They have escalating need for services with the aging population, so they need to push more self-management and they need to get patients better engaged and to improve adherence. But the other area that I think is really interesting is there's different levels of maturity in different countries on this. They need to move to value-based healthcare. So value in terms of the Michael Porter School of Thought is around understanding an individual health outcome and the cost of delivering it. And a lot of health systems today value or reward inefficiency. So it's about activity pricing. So if you don't deliver a good outcome, you actually get rewarded because people keep coming back in for repeat visits. And there's well documented cases. There's, in hip replacement is a common one, where by measuring the outcomes, you can improve the healthcare and you can reduce the cost by improving the incentives. The other thing that's important around the value-based healthcare school of thought is that it changes what type of data you need to collect, and also that data needs to be considered and valued around what's important for a patient, i.e. a patient's condition. So for us, we follow a design process that looks, so we look for passionate patients and clinicians. We look for where there's an unmet need for a digital therapeutic. So in most cases, the third point will be the case, but we look for where there's a benefit in collecting and augmenting different types of data sets. And then we have to look at, is there a potential route to reimbursements, and how would that work? So we've built a patient self-management platform. So at the moment we're working across 3 different therapeutic areas. The second bullet point there possibly looks like a contradiction. So we believe it can be highly customized, but we can do it in a scalable way, because we're trying to do things in a programmatic ways as much as possible. And we're looking to increase engagement, where that's kind of a core part of what we're looking to do. So kidney transplant is the main area that we started out working in. So the patient problem is there's poor adherence. And in a therapeutic area where poor adherence, there's a good chance that will lead to the loss of a kidney transplant. That seems quite a shock when you start looking at it at first. The other problem area for patients is there's poor blood pressure control. And poor blood pressure control will shorten the lifespan of the kidney transplant. So tied in with this, there's a lack of understanding of the medications, the side effects, and actually the impact of the non-adherence. The knowledge that a single missed dose of medication could lead to the loss of a transplant. That message doesn't really hit home in a lot of cases. So we're working with the Irish Kidney Transplant Centre. So we've been testing with, we've been in a beta phase for close to a year now at this stage. And we're at the point now where our solution is going to be embedded into the standard of care. So every transplant patient will be offered this digital intervention as part of their standard of care, and will be given a blood pressure monitor as well. We're also trialling with 3 UK kidney transplant centres, and we've planned integration with the UK Renal Registry. So just a few kind of points on the health economics of transplant. So transplant is a very, very successful intervention from the patient's point of view in terms of their quality of life, but also from the health economics for the health provider. So in the UK, the NHS saves about £6.3 billion by transplanting patients, and that's versus the cost of having those patients on dialysis. Part of a literature review that we're doing is how much of that saving is lost due to non-adherence and poor blood pressure control, because a significant component of that is lost due to the earlier than what should be expected transplant loss. In Europe and North America, there's 36,000 new transplants a year, and that's growing because of the onset of type 2 diabetes leading to more kidney failure. There's an estimated patient population around 700,000. So I'm coming down to meet Jane and Jerry and Eamonn in Galway for quite a while now. One of the things they got me thinking about early on was the UCL, behaviour change taxonomy. So we're trying to embed things from that into our application. So get patients to set goals around adherence, get them to set up medication reminders, get patients to respond to the triggers, give them feedback, compare them to their peers. But then also we're trying to automate and trigger educational content to help change their beliefs. So educate them, inform them why medication is important. So we're triggering this at known points when where they're likely to become non-adherent. So a typical kidney transplant patient will, for the first 6 months, be very, very aware of kind of their life while they were on dialysis. But after 6 months, a lot of patients become complacent, and that's when non-adherence starts to creep in. So we trigger kind of a reminder at that point, but we can also trigger reminders when we detect missed medications. So we've developed a range of content for different types of cues and triggers. In fact, the one in the top left was one that we discovered through patient interviews. So we were asking patients the nice questions around, did they forget any of their medications in the last 4 weeks? And interestingly, the most common time people miss their medications is when they were in the hospital. So they're told to come into the hospital to get a blood test. The blood test has to be taken when they haven't taken their immunosuppression, and they forget to bring the medication in, and that's the day they miss it. So they set up appointments in our application, and we trigger them a reminder to bring the medication to the hospital the morning of the appointment. So we're starting to schedule the content, so we're embedding the content in with the patient pathway. A lot of the content is timed, but we're starting to build in context-aware content updates. So an example is the immunosuppression gives them an increased risk of sunburn and skin cancer. So correlating with UV index and giving the reminder around being skin aware and those sort of occasions. We're also measuring the effectiveness of the triggers, so views, clicks, and all of the messages can have thumbs up, thumbs down, or those types of feedback that we can get on the messages. So on the blood pressure control, we're trying to change behavior there as well. So first of all, we want them to set targets around keeping their blood pressure in good range. Then get them to actively monitor, and pushing them prompts to monitor. So again, we've got videos around this. We've got a lot of experience on how to integrate these types of devices in. It's been touched on a few times today. That was my desk a few weeks ago with the range of blood pressure monitors. I've added another 2 this week, so it's much more difficult area than you would think. Integrating Bluetooth devices into mobile applications and finding ones that are easy to integrate, that give a good user experience, but are also clinically validated. So getting those two together right is quite difficult, I can tell you. As part of it as well, so one of the other areas we're trying to promote is health literacy. So we prompt patients to prepare for appointments about 3 days beforehand. So I mentioned around efficacy, so we're in the final stages of the study protocol, of designing the study protocol. So this will be conducted in Beaumont Hospital with 1 year's worth of new transplant patients, and it'll be studied along with the Royal College of Surgeons in Ireland. So the second therapeutic area we're working in, so there won't be as much detail on those, Brian. It's prostate cancer, so we're going live this month with delivering patient-reported outcome measures for IPCOR across 16 Irish hospitals. And then there'll be a phase 2 element of that, which will be delivering a patient support app for helping men manage their prostate cancer. As part of that as well, we're actually also hoping to integrate in with the HealthLink system for automating the population of the PSA results. And the third therapeutic area we're working in is IPF. So it's a rare lung disorder which has very, very poor outcomes. And part of the unmet need that's why we looked at this area was the fact there's no one really gathering data. There's no validated patient-reported outcome measure in this area. So we're working with academic and clinical partners and helping pull something together in this area. This was touched on earlier around open data and integrating with data. And one of the times I was down with the guys here, we were talking about moonshots and we were talking about Joe Biden. And this area is a hot topic in the US at the moment because Joe Biden's son died, I think, in the last year. So he's raised the moonshot about curing cancer in certain areas. But he's also brought to the top of the political agenda in the US around open data. So his son had to be transferred between 2 different hospitals in the US that had got lots of US government money for meaningful use and interoperability on electronic health record systems, and they had to print all of his medical data and fly it to the other hospital. So it's a massive area, and I think everyone needs to, anyone that procures any health information systems, they need to be demanding that it's based on open standards, and we're following the Open Air and the FHIR HL7 standards. And that's it for me.